So my name is Brian, and we'll be doing trigeminal neuralgia today on my patient Nelson. So basically, trigeminal neuralgia, it's a treatment where it involves head, neck, and shoulders, and his trigger area is any pressure on the face. So any kind of pressure on the face will trigger his symptoms, so we're going to be staying away from that throughout the treatment. Alright, so we're going to start the treatment. I'm going to be starting off with introductory techniques. So we'll start off with static contact, so the patient is able to get used to my touch. And then I'll just alternate to light stroking. Okay, so now we'll be moving on to superficial techniques. So we're going to be engaging a little bit of fascia. So the reason why we're doing this is so that the patient will have relaxation felt. Okay, so Nelson, if you could move your head down the table and off the table into my hand. Good. So just rest and relax. Okay, so we'll be treating the traps, the SCM, posterior muscles, and suboccipital muscles.
Demonstrating body. So, Sam, what area of your body is the left side of your ribs?
We'll start on the posterior neck. So I'm just gliding on his posterior neck very gently, not engaging the tissue too much, because we're going to try and relax the posterior neck muscles.
Second focus will be your legs, so then we'll let you turn over to the sideline and then undrape your back and proceed with treatment.
So the strokes are going to be slow and rhythmical, so if the patient does feel any pain, it won't be too intense for him, and he'll tell me before the pain actually occurs. I'm going to ask the patient to turn his head slowly to the right side, and then we're going to perform gentle kneads on his SCM.
You're doing fine there.
Oh, no, I can't see anything.
And then we'll move on to his trap muscle on the left side, since we're on this side. So we'll need a muscle squeeze. Trap gently, not too much, just to relax the muscle and promote stress relief. And then we'll alternate with superficial effleurage to give patients breaks in case it's too much pressure. Squeeze and alternate. Now we'll switch to the left side and gently making sure that we're avoiding any contact with the face.
So you're going to get the patient to raise their arms above their head. Support the head.
And then alternate between muscle squeezing.
30 seconds.
and superficial effleurage. Making sure that the technique for superficial effleurage reaches the insertion of the traps. Muscle squeezing. And then finish off with more effleurage. So for the final technique, for the neck is GTO release to promote relaxation of the suboccipital muscles. So I'm going to ask Nelson to scoot back down the table.
So there's only 9 minutes left.
Alright, just relax, Nelson, and I'm going to apply pressure with my fingertips to the suboccipitals. And then gently rock the head back. Or just keep it static. Okay, so now I've moved my patient inside lying so I can treat his back for general wellness. So that will promote relaxation. So I'll be using like light techniques as superficial effleurage and maybe get into deep muscles, but very moderately just to promote relaxation. And I moved him into side lying so that there's no aggravation upon the face, since if the patient was prone, he would have his face in a face cradle. Okay, so I'm just going to drape his back and I'm going to perform superficial techniques to overall back. So right now, I'll just work in quadrants. So left quadrant first. So I'm just engaging the fascia right now and just a little bit of the muscle tissue.
Are you going to be in the study room on break?
And his right quadrant, also engaging just the fascia and a little bit of the tissue. So you would perform this general back massage for around 10 minutes of the treatment, but mainly focusing on the head, neck, and shoulders. And this will just promote general relaxation for patients suffering from trigeminal neuralgia.
Yeah, it's like mainly here.
Okay, so that's the basic treatment for general neuralgia, general trigeminal neuralgia. So that's it for today.